According to the National Institute of Mental Health, approximately 49.5% of adolescents aged 13 to 18 experience a mental health disorder in their lifetime. This translates to about 1 in 2 teenagers. Wow, that is a truly staggering statistic. With so many of our teens struggling, I invited Dr. Zendi to give us some advice. She's a pediatric, functional medicine, and mental health expert with a lot of experience working with teens. We talk about why so many kids are struggling, how to notice signs of mental health struggles in our teens, the difference between anxiety and depression, and habits that will help our teens be mentally healthy. Her functional medicine holistic approach is really fascinating, and I think the approach of the future. If you listen in and love the content here, Dr. Zendi has generously provided a free guide just for our listeners. It's called Anxiety and Depression in Kids, A Parent's Roadmap to Root Causes and Real Solutions. So make sure you go to the show notes after you listen and grab that free gift. Welcome to the Daily Wellness Podcast. I'm your host, Melissa Meredith. I've led my family on a transformative health journey for over a decade, and now I help other families do the same. This is a place where busy moms can learn about healthy living. I hope that what you learn here helps you feel empowered to take the next step in your family's health journey. Dr. Zendi, thank you so much for being with me on the Daily Wellness Podcast.
Thank you so much. I'm so excited to be here with you.
Yeah, you really piqued my interest because when I found you, I saw that you were in pediatrics, you were in functional medicine, and you were in mental health, which is really unique. And so can you just tell us how you arrived in this role that you're in now?
Oh, absolutely. Yes. Well, like you introduced yourself from being a small town Missouri girl. I am a small town South African girl. Mhm. And I completed my bachelor's of nursing at the University of Cape Town in South Africa. And at the time, I was working on a ward with children with primarily chronic kidney disease. And these children weren't being served from a mental health perspective at all. And I noticed that. And I couldn't get that kind of training that I needed to deliver more emotional mental health services in South Africa. So I had to look abroad. And I arrived in the USA in 1996, and I've been in Rochester, New York the whole time since then to complete a master's degree as a pediatric nurse practitioner, because back there in 96, there wasn't a psychiatric nurse practitioner specifically for children.
Wow.
So I finished my PhD so I finished my pediatric nurse practitioner, and then I went on for a PhD in nursing. And along the way, I got a postmaster's as a psych nurse practitioner because I felt like I really needed to combine. That's the skill set I was looking for in both pediatrics as well as psychiatry. And I worked as in both roles post school. And I feel like I've finally come full circle because while I was working as a pediatric nurse practitioner, I was so also interested in mental health for children. And when I was working as a psych nurse practitioner, I was noticing the physical health issues. So now, for the last 10 years or so, I'm trained and have studied functional medicine, which is looking at the root cause of conditions. And I combine pediatric nurse practitioner with psychiatric nurse practitioner from a functional medicine perspective. And it's so powerful because finally I can really look for root causes to whatever the symptoms are that present themselves, whether from a medical or from a psychological perspective, to really help that child truly heal rather than just band-aiding the symptom with, for example, a medication. So
Yeah.
I find it's very powerful, very effective, and parents really want it.
Mm. Well, I mean, you're talking about functional medicine and you have an amazing accent. So if I can just keep you talking for a while, I'm going to be happy. So you've been in this for a while,
Really.
long enough to notice patterns and trends and things that are happening in that mental health space for our teenagers and teenagers. What have you been noticing in the last 5 years or so?
Um, I certainly have noticed that the rates of anxiety, depression, ADHD, autism spectrum disorder have increased dramatically in the last over 20 years that I've been practicing in the US. I mean, just take autism spectrum disorder. Back in 2000, the rates were thought about to be 1 in 150 kids, and now it's 1 in 36 children. So that's more than 175% increase. In when it comes to childhood depression, the thought was it was about, um, the rates increased by about 30% in the last 10 years, and about the same for anxiety. So I've really seen a huge increase in all of these childhood conditions over the last 5 to 10 years.
Yeah. Do you have any thoughts on why all these mental health conditions are increasing?
Well, I think that it's multifactorial. There's many, many reasons why. I think that there's increased social media use in children and teenagers, a huge use of screen time rather than children being outside with free play and in nature and having to use their imagination and play outside. I think there's been an increase in academic pressure and performance in our children at a much younger age. I think that the stresses of COVID-19 certainly increased the rates with regards to social isolation, missed milestones. I think kids missed out on a variety of academic, social, emotional milestones along the way that kids haven't fully even caught up with yet, I would say in the last, 3 years or so. There was certain increased tension about that, and then I think if we look nationally and even worldwide, there's kids are worried about school shootings and political unrest and war in parts of the world. One of the things that I also think has contributed is there's been a great increase in toxins in our environment, and the standard American diet doesn't exactly support children's nutritional requirements or toxins, and toxins in food can definitely affect children's immune systems. So kids get sick more often. And I've seen a huge increase in conditions like PANS or PANDAS because kids get physically sick more often from things like viruses or strep or mycoplasma. And that results in an actual change in the brain, resulting in symptoms that present behaviorally or present psychiatrically, but they're actually a medical condition.
Yeah.
And lastly, I think that I've seen a huge increase in Lyme disease. I think it's been documented that we definitely have more ticks. I think there's changes in climate have increased the rates of ticks in the environment. It used to be mostly in the Northeast, and now it's right across the states. And so I've seen an increase in Lyme disease. And in my context, that presents itself as psychiatric or behavioral problems.
That's very fascinating. Let's talk about a couple of those. What is it about screen time that's harming our kids?
I think that when children are focused on screen time, it takes away from other developmental needs or other developmental milestones that children need to be progressing, and especially socially. Because it's often a very passive process. Kids are passively engaged with screens rather than actively engaged with communication, like having conversations or playing in person with other children. But then there's also a huge social media influence. If our kids are on screens for hours and hours, then they're being influenced by whatever they're seeing, whatever the influences are expressing. And so I think that teen girls are having to grow up too
Mm.
quickly. And there's a lot of social
Yeah.
pressure with regards to how many likes they get and how they look. And then there's a lot of bullying online as well. And that's where kids are spending a majority of their time compared to years past.
Yeah, I agree. I think that's a huge problem, and it's just like a constant thing too. It's like there's no break from it, right? If you're not on social media, then you're always worried that something that you're doing, somebody might end up posting on social media. That you always have to have this like presence of like wariness where is somebody going to take a picture of me and post it? I have to be aware of what I'm doing all the time because I never know what's going to end up online.
Right. And then kids are not in the moment of that experience with regards to whether it's a sleepover or a play date or, spending time on a beach instead of like being in the moment with that activity, there's always sort of needing an observation of themselves in terms of how they might appear in case that was going to be posted online.
Right. Yeah.
And I think that really increases the rates of anxiety in children and teenagers. And anxiety and depression are so closely related as well.
Yeah, that's true. I definitely want to talk about that. Another one you mentioned as a contributing factor is the toxins in food, which is a huge passion of mine. So I love that you mentioned that. And you mentioned the immune system. Can you explain a little bit more what the connection is between food and our immune system and our mental health?
Absolutely. So often our immune system is primarily situated in our gut. 70% of our immune system is in our gut because it's a huge surface area that has to surveil friend or foe the whole time. And what we eat engages with our immune system in our gut. And that's where we make over 90% of our serotonin, which is the neurotransmitter needed to be calm and to not be depressed. So many processed foods that are high in seed oils and glyphosate and sugar, affect our microbiome and disrupt the balance between healthy and unhealthy bacteria and yeast. And just that imbalance can actually result in a lot of gas that can be absorbed systemically, that can increase things like anxiety and what looks like ADHD and depression. The integrity of the gut is super important because otherwise toxins can get through and interact with our immune system. And antibodies to various toxins or antibodies to various infections that kids are exposed to can become a little confused. The immune system is kind of disrupted. So, one, it's sort of a little punky, so it's getting sick too often, but it's also overactive, and those antibodies can interact with the body. For example, those antibodies to, for example, strep. Kid is exposed to strep, they're supposed to create antibodies to fight that infection, and then everything goes quiet again. But what we're seeing more and more is those antibodies then cross through the blood-brain barrier, inflame the basal ganglia, and then result in a lot of emotional symptoms like anxiety, depression, OCD, and behavioral changes like rage and a change in school behavior and insomnia. So we've got this exquisite gut brain connection that needs to be kept in balance. And there can be so many insults on that system that kids need to be able to manage and can't because we've become sicker and sicker over the last 10 to 20 years.
Right. And is that gut brain connection, is that why they call the gut the second brain
Oh, yeah.
sometimes?
Yes.
Yeah.
What's fascinating to me is in utero, when that little fetus was tiny, it was actually the same tissue.
Wow.
And as the baby grew, that tissue pulls apart and creates a gut brain and a head brain, and it's connected by the vagus nerve. And so the vagus nerve has this beautiful communication between the gut brain and the head brain, if you will, and it goes back and forth, back and forth. And so a disruption in the head neurotransmitter system can affect the gut and vice versa. If there's a disruption in the gut, it can affect the head brain. And I find that fascinating.
Yeah, that is I agree, it's totally fascinating. So, you have all these outside factors, the social media pressure, the screen time, the academics pressure, the stress of what's going on in the world, different things like that, but that can impact your mental health, and but also our teens are also being impacted by what we put in them, right? The things that are entering their body through their food or, even personal care products, right? And the toxins that we're exposed to in that way, does that
Absolutely.
contribute as well?
Absolutely. So definitely with there are many toxins in personal care products, in makeup, in cleaning supplies, in plastics. I love an organization called EWG.org, the Environmental Working Group, because they have a huge database that people can access to check how safe their personal care product is. They can actually download the little app, and when they're at the grocery store, they can just swipe the barcode and see how safe their product is. And they also produce every year they publish a list of the clean 15 and the dirty dozen foods. And those are foods that are exposed to the highest amount of pesticides. And so those resources can be really helpful for parents to make decisions about where they spend their dollars with regards to whether they buy organic or not, or
Yeah.
which kind of products they buy. Because absolutely, those toxins can be absorbed systemically and disrupt hormones
Mm,
because many of them are endocrine disruptors, and hormonal balance affects mental health as well.
yeah, absolutely. Yeah, those chemical messengers in our body, right? Yeah. So one thing that you have mentioned is anxiety,
Yeah.
as being something that has really increased in kids. So if we're trying to kind of evaluate our kids, kind of keep a watchful eye over them, how can we kind of tell if what they're experiencing is just some, intermittent anxiety periodically versus an anxiety disorder? Like what kinds of things, I guess, what's the difference and what can we look for to kind of know what our kid might be dealing with?
That's an excellent question. Thank you for asking that. It really depends on the symptoms' severity and persistence and impact on daily life, and very often how it even manifests in the body. So, you know, anxious feelings are part of life. We all have it, adults or children. And they are often temporary. So, like maybe being nervous before a test or nervous before a performance. That's pretty typical and common. It doesn't interfere significantly with life. So, kids are able to go to school and have social relationships. Children can be easily reassured by their parents and move on. And it can fluctuate a little bit. So sometimes it can be a little worse, sometimes can be a little bit better, but it doesn't cause any long-term distress. However, when it comes to the signs of, for example, an anxiety disorder, you might see persistent and excessive worry that can be on a daily basis, and it can be last for weeks or even months. And the worries can often feel like they're unrealistic, they're extreme, they're out of proportion to the experience at hand. And even little things like having to go to school can trigger huge distress. So definitely persistent and excessive.
Okay.
Then noticing the impact on functioning, and an anxiety disorder can have a much more dramatic impact on functioning, like avoiding behaviors, like avoiding going to school, or a decline in academic performance or relationships, or an inability to complete daily tasks. Very often, anxiety disorders have physical manifestations as well. So, children can experience frequent headaches and tummy aches and nausea, feeling really tense in their bodies. They can have trouble sleeping, either sleeping too much, for example, in depression, or not enough, or having nightmares, feeling exhausted because they're not sleeping well. And then often children will explain about their heart racing, or their sweating, or dizziness, or shortness of breath. And these experiences are often quite dysregulated with regards to children's emotions. So there's kids can have meltdowns and excessive crying over something that seems relatively small. They can have lots of outbursts. They can have extreme panic or fear. And again, when it doesn't seem appropriate in terms of what the actual trigger is. And then I think it's important to watch out for any compulsions that start happening, which are behaviors that are recurrent in ritualistic or repetitive behavior, like excessive reassurance seeking. Mom, is this okay? Mom, is this okay? Mom, is this okay? Like driving a parent crazy, seeking reassurance rather than just like a once off or a daily thing. This can be excessive, needing to have things just right, having to like touch their body part or touch a doorknob just right, or having to wash hands frequently. So I would say that those are some of the symptoms where parents want to be paying attention and seeking out care, especially if symptoms have lasted for a long time, they exist in multiple areas of life, they're affecting behavior, they're leading to avoidance of regular activities and interfering with daily life, and definitely looking for those ritualistic or obsessive behaviors.
Those are great tips. If a parent does feel like they need to reach out for some professional help, what
Yep.
kinds of questions should they be asking or what should they really be looking for in a therapist?
Oh, that's a great question.
Mm.
I think somebody who definitely specializes in the age of the child, because a therapist for a young child has different skill sets to a therapist for a teenager.
Right.
Being a mom myself, I certainly love to understand behavior and help for kids within a developmental context. And definitely you will have to interact with a teenager very differently from a young child. So I think choosing a therapist that has experience in that particular age group, a therapist that is going to work with parents, because there needs to be collaboration between the parent, the therapist, and the child, because the parent is with the child for the whole, all the time.
Yeah.
A therapist that is gonna really listen to what the concerns are and kinda get it and make that connection, both with the child as well as with the parent, and obviously somebody who's effective in terms of being able to help both the parents with skills to help them cope and to help them coach their kids, as well as to help the child themselves. So a young child might really benefit from play therapy, whereas an older child might benefit from cognitive behavioral therapy.
Okay. Those are great tips. In your practice, I know that you take a pretty unique approach. You go beyond talk therapy and beyond just medication. Can you kind of describe what your approach is?
Absolutely. Well, I practice functional medicine and functional psychiatry, which is really looking for that root cause for whatever the symptoms are, whether somebody enters via physical symptoms like heart racing and shortness of breath and dizziness, or whether somebody enters with the complaint of fear and OCD and panic symptoms.
Right.
So, whatever the symptoms are, we're always thinking, what is the root cause? What could be going on um, physiologically within this child's environment? Lifestyle factors, nutrition factors, neuroinflammation from infections like strep, for example, nutritional deficiencies, hormonal imbalances, immune dysfunction. So we really take a very systems based whole child approach, looking not just at anxiety, but where is it coming from and what is influencing it? We do a lot of testing, both functional medicine testing as well as just starting with some basic blood testing, like looking at low vitamin D or B12 or iron. Like even some basic labs like that can be corrected and can improve symptoms. And then with very individualized with our treatment plans. It's not like a cookie cutter, this is for everybody. Yes, we might sometimes use medications, and yes, we might sometimes use supplements. And definitely, we speak about lifestyle changes like, is the child getting enough sleep and exercise and downtime and decreasing screen time and looking at nutrition? So it's that is informed, that the individualized treatment plan is informed by the history and findings that we uncover in that process.
So it's a combination when you're looking for those root causes of going back to those all those factors that we talked about really at the beginning, right? All the things that could be contributing,
Yeah.
but also some testing, some specific individualized testing for that patient.
Yeah, absolutely. So we start off usually with basic blood work. So looking at kidney function, red and white blood cells, infections, nutrients. But we will often look at poop tests because we want to understand the microbiome. We might look at environmental toxins, like molds is a huge area that can influence mental health. Looking at heavy metals, for example, we might look at genetic markers and studies of things like methylation, because our genetics absolutely affect our mental health as well. So we will, again, informed by the history and what the symptoms are, we've got quite a big toolbox to draw from to further validate and gather that information that then drives treatment.
Yeah. This seems like a common sense approach to me, honestly, because our body is not just, our mind is not just a thing on its own, right?
Right.
Or it's right? It's not just this thing operating on its own that, is not impacted by anything else going on in our body. Our bodies are so intricately and
Put together.
sophisticatedly, yeah, put together and connected. So I love this. This totally makes sense to me. I think this is such a beneficial approach. What benefits have you seen, with patients coming through and really getting this whole, body approach, to their mental health?
Parents really appreciate this approach because parents often come to us frustrated.
Mm.
They are frustrated and frankly disappointed with a conventional approach, whether they've come from their primary care doc or some kind of specialist like a neurologist, endocrinologist, or the mental health field. Parents are often frustrated that they weren't listened to, that they weren't partnered with. They were frustrated that they feel like there's something else is going on, but nobody listened to them. Or there's been an over reliance of medication management. So often kids will come to us on multiple psychiatric medications, but no better. Because maybe they didn't need those particular psychiatric medications because they had mold toxicity or an infection or nutrient deficiencies that needed to be approached, and psychiatric medications are not going to help with those. Yes, we sometimes use psychiatric medications as part of the bigger plan, but there's not an over reliance. And so, by really looking at root causes, we are able to get at what the true cause of the symptoms are. So we're able to have long-term improvement, like actually helping a kid get better and then being done with that diagnosis of depression, anxiety, or whatever. So it's hugely successful. And what's so often interesting is the kids are nearly like the canary in the coal mine, if you will. Like they come to us as the primary patient, but the principles that the parents learn in going through functional medicine or functional psychiatry care for their kids can then be applied to their own health as well. So either the siblings' health or their own health. And so there we often see like huge changes in the whole family, which is also really cool. It's exciting.
No, it's very cool. I mean, that's huge. It's almost like preventative medicine at that point.
Yep.
Yeah.
So I feel like it really empowers families because when we partner with families, when we listen to them, when we provide tools and answers and strategies, parents feel empowered to be able to help their kids, not just now, but in the future. And I think that really improves long-term resilience in both kids as well as families.
Absolutely, I'm sure it does. So what can you give me as an example of what a treatment plan might look like? So after somebody comes in and you kind of evaluate their lifestyle factors and maybe toxins that might be influencing them, and maybe they do some blood work and things like that. What might a treatment plan look like?
Uh, uh, Great question. And again, it would definitely be informed by the history and by the testing. But for example, say we uncover neuroinflammation, for example, then we might really want to treat those infections creating neuroinflammation, whether that is Lyme or mold or mycoplasma or viruses or strep. And we definitely also want to lower inflammation because depression, for example, is thought of as an inflammatory disorder of the brain. And so we might want to be using things like curcumin or omega 3s or vitamin D to help with that inflammation. We would want to be talking about diet and having a very anti inflammatory diet, again, to help with that neuroinflammation. If we're wondering about a gut brain disruption, we might be speaking again about food in terms of taking out those triggers that are resulting in an inflamed gut, whether that's
Mhm.
wheat, gluten, glyphosate, dairy, and putting back some really good ones like bone broth and organic fruits and veggies and real proteins. Um, so we would want to probiotics are definitely a big thing that we will include in terms of trying to help heal that gut-brain connection in the leaky gut. Um, Sometimes if we might uncover histamine issues, we would want to do a lower histamine diet and stabilize those mast cells. That's a huge issue with regards to anxiety and panic attacks. So there's a variety of things that we can do to, use mast cell stabilizers. If we were suspicious about nutrient deficiencies, will be testing for like low iron or low D or low B12, and then we want to put that back in as food or as a supplement. So magnesium, for example, is a huge nutrient that is deficient in so many adults or children in the US. And magnesium is super helpful for anxiety, super helpful for sleep. So we would want to include magnesium, whether that's from putting a cup of Epsom salts in the bath to be absorbed through the skin or taking that orally. Um, we might want to replace iron, especially our
Mm.
teenage girls. Once, girls start having their menstrual cycles, they're losing a little iron every month. They might not be eating enough red meat, and so they might be more depressed or more anxious or not sleeping well because they have an iron deficiency. So we want to
Yeah.
put that back in. Um, um, when we think about hormonal disruption with regards to mental health, whether that's the gut brain influence or whether that's adrenal influence. We might be looking at cortisol measures and wanting to support their adrenal system, or we might want to be looking at the balance between estrogen and progesterone. Just in that imbalance, usually higher estrogen, lower progesterone, is going to result in panic and anxiety. So correcting that improves the panic and anxiety. It's so
Yeah.
cool. And then thyroid. Thyroid is so important. So whether that's either too high or too low, usually it's too low. That might look like depression, but correcting the thyroid will improve depressive symptoms. And then finally, looking at environmental triggers. So looking at the environment with regards to mold toxicity or heavy metal toxicity or EMF sensitivity. That needs to be addressed systemically as well. And then finally, I one more is looking at trauma and attachment. And and healing that. So we definitely love to partner with therapists and counselors because there's a medical aspect, there's an environmental aspect, there's a nutritional aspect, and there's also a relational trauma attachment aspect very often to the presentation or the underlying root cause to emotional distress. So partnering in that capacity is helpful as well.
I love that. Very comprehensive. I love that. Do you find that some kids also kind of need the talk therapy on top of these physical things that you're addressing in their bodies?
Yes, I do, because often children or teenagers or parents, because I take care of adults as well, have had these symptoms for a long period of time. And so they've started organizing their life around them or coping with symptoms in a certain way. And so while they're improving from a physiological perspective, there has to also be a healing and improving from an emotional perspective or a coping skills perspective or looking at a situation through a different lens. And so we love partnering with mental health providers to help with that aspect of healing.
Yeah, that's great. And I love that you have all of those aspects. Again, I mean, I we just said this earlier, but it is really amazing to see a practitioner that is really integrating, all of these different bodily systems to help these kids actually get healthy, right? Not just, take a medication that may or may not help with some symptoms. But your integrative approach is really inspiring, and as a parent, I'm just like, I'm so glad this your resources out here, and that you're available to help families, because this is definitely what we need more of.
Thank you. I'm really committed to this work, both
Mm.
to educate parents that this care is out there and what they can do to help their own kids, as well as other healthcare practitioners who often don't know about functional psychiatry or functional medicine. It's such a powerful way of practicing, and I really want more practitioners to know about this.
Right. I think it's the way of the future, honestly, because you mentioned you have parents that come to you frustrated.
Yeah.
And I think we are hearing that like more and more, right? People are getting very frustrated with a system or practice of medicine that only looks at one aspect, right, of our bodies or our minds, or doesn't connect the two. So I think it's definitely the way of the future. Yeah.
Right. I agree with you.
Yeah. What are some things that parents can do to just really promote good mental health in their kids and their teens?
Absolutely. Parents are so important to their kids, and there's lots that they can do. I would say starting with fostering emotional resiliency. Parents, I encourage to really validate children's experiences and feelings rather than dismissing it. So, for example, if a kid is anxious, instead of saying, oh, it's not such a big deal, just get over it, rather validating by saying, for example, I see you feeling anxious. That makes sense. I'm here to help you. Let's figure it out together. And teaching kids things like deep breathing or journaling or visualization, encouraging those open conversations in a judgment free open space so kids can feel comfortable coming to their parents to discuss what's bothering them, asking about their day. Hey, what was the best and what was the hardest part of your day, and how can I support you in feeling it while you're feeling distressed or anxious. I think kids are watching us all the time. So parents need to also be modeling healthy emotional responses because kids do what we do, not always what we say. So, so parents modeling healthy stress responses like healthy exercise, positive self-talk, deep breathing. Kids are noticing what their parents are doing and will learn from that as well. I would say parents to avoid catastrophizing, it's all bad or it's all good. Rather, reframing like, oh, this was particularly hard, but I know I can cope, or I know what I can do, versus feeling completely hopeless in a situation. I think helping kids with healthy habits is helpful, specifically optimizing sleep for brain health. Kids are not getting enough sleep. Kids are going to bed too late, they're too busy, they're up late on screens. So children need a minimum of 8 to 9 hours of sleep. Some kids need more. So no screens at bedtime, winding down before bedtime, having a nice dark bedroom, and really optimizing sleep. I think parents can really help their kids with all of what we've been discussing with regards to nutrition. So, decreasing processed food and artificial additives and colors and dyes, and instead promoting, nutrient dense, organic foods that are high in protein. Because remember, protein is the building block for the neurotransmitters. You need enough tryptophan, which is an amino acid from protein, to make serotonin, to make melatonin, for example. So healthy fats, healthy fibers, protein, some key nutrients that parents can use safely would be things like omega-3s or magnesium or zinc or iron if that's found to be low. Probiotics can be very helpful. I think encouraging kids to move and play outside, and engage in other activities that can help with calming, like yoga, for example. Walking in nature can be super helpful. And um, building connections. Those connections with parents are super helpful. Like that, making it a priority to have those one-on-one periods of time in which kids can feel connected, whether that's reading a story together or discussing their day or watching a show together, and encouraging friendships and socialization with peers as well. Because I think so often kids are feeling disconnected, and that social isolation is not good for their emotional health. So I think those are all some practical things that parents can do, and they play out an important role in their kids' mental health.
Yeah. Well, I'm going to try and talk my kids into going on a walk with me this afternoon and tell them that Dr. Zendi said we need more time in nature.
There you go.
I love that. I love getting outside. Hopefully it'll get a little bit warmer and that will be easier for us. At the time of recording today, it is chilly. Yeah, and upstate New York, feel it. Feel the lack of nature. Yeah. Thank you so much for your time. How can people keep learning from you and stay connected with you?
We are located in Rochester, New York, and our clinic's name is Arbor Health. So we're at arbor-health.com. We have a Facebook, Instagram presence for the Arbor Health. And I would love to offer your readership a gift with regards to helping them understand more about the root causes of mental health concerns and what parents can do to help their kids. And so that is something I'd love to leave your audience with as well.
Wow. Thank you so much. Yeah, we'll definitely include that in the show notes. Do you work with clients virtually or just in person?
We did both. We are in New York, so unfortunately, folks either have to come see us in person in our practice or live in New York, but we offer both in person as well as virtual. And we see children, adolescents, young adults, all the way through the whole age range, because we practice both functional medicine and functional psychiatry. And I love our approach to care because we practice with health coaches. So every patient gets both their nurse practitioner and a health coach in order to be successful. So I love our collaborative model of care at Arbor Health.
I love that too. Thank you for your time with us, for sharing your wisdom, and thank you for the gift. It's very generous.
You're very welcome. Thank you so much for the opportunity to share this with your audience.
Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.